Hello, wonderful viewers. How is the harmattan treating you and how are you taking it? Though we've talked about harmattan and then its effects on the skin and the body in general, there is a need for us to re-echo it based on the information from Ghana Health Service on February 2024. Ghana Health Service on high alert for cerebrospinal meningitis disease outbreak in the country Ghana on 12 February 2024. This is quite alarming, right? Because cerebrospinal meningitis is not a disease that needs to be joked with. So, let's look at what cerebrospinal meningitis is. This is an inflammation that occurs in the area around the brain and spinal cord. Do remember that it can also be called spiral meningitis. This is the Lab Doctors channel. I'll entreat you to follow us, subscribe to our YouTube channel, the Lab Doctors channel. Follow us on Facebook, Twitter, Instagram at the Lab Doctor. So, I know that most of you wants to know why cerebrospinal meningitis possible outbreak by Ghana Health Service, but not any other disease. This is the reason why. So, cerebrospinal meningitis is one of the infectious disease that thrive in a dry, dusty weather condition. From our current weather condition, which has seen an increase of the intensity of harmattan, dry and dusty weather condition, has alarmed the Ghana Health Service to bring this important information to all Ghanaians. Also, let's take note that Ghana is part of the countries that lies in meningitis belt. So if you look at the data over the years on cerebrospinal meningitis, Ghana has tended to have high increase of cerebrospinal meningitis cases, which means this year is not an exemption. To add to this very point, the last time Ghana had cerebrospinal meningitis case was a 2020 outbreak in the Upper West region of Ghana. So, there is a clear evidence of a previous outbreak. However, due to our able clinicians and health experts, especially Dr. Franklin Asiedu Beku, the Director General of Public Health Service within the Ghana Health Service, has issued a statement meaning that there is an ongoing monitoring of event by event of any possible outbreak. And so I believe that by so doing, if in case there is an outbreak, there will be an early detection and therefore a possible early measures to curtail any rising situation of that sort. Based on this information, Ghana Medical Association has also cautioned the general public, Ghanaians, to wear face masks or what we know as nose masks and also limit our outdoors activities, especially to children. Someone may ask, so why is Ghana Medical Association also on this particular issue? Remember, in our first submission, I made mention of cerebrospinal meningitis thriving very well in dry and dusty condition. And then in this intense harmattan season, currently occurring in Ghana has resulted into dusty condition all over the country. Remember, this information is backed by Environmental Protection Agency. You can go to their website and verify. So with all this information, Ghana Medical Association needed to come out with measures to help Ghanaians in this very situation. Before we move to another most important advice that was given by Ghana Medical Association, let's look at what dust does to the human body. So when there is increase of dust and dry weather condition, there is a serious or severe health complications that comes along with these very conditions. It can result in respiratory problems such as asthmatic attack and other chronic respiratory condition. Let's move on to the next advice that was given by Ghana Medical Association. They advise Ghanaians to stay hydrated by drinking water all day. And also, people suffering from respiratory conditions such as asthma are advised to take along with them their inhalers and also make sure they take their prescribed medications. Ghanaians are advised to stay alert and also to abstain from self medication. Do not also attribute all fever to malaria. Kindly visit your doctor for proper examination. In case you also experience these signs and symptoms, such as painful swallowing, chest pain, difficulties in breathing, running nose, please do not hesitate to report to the nearest health facility for proper examination. I hope this information was very helpful to us all. Please, this is the Lab Doctors channel on YouTube. Kindly subscribe, share our videos, like, and then comment. Please, you can also find us on TikTok, Instagram, and Twitter at the Lab Doctor. Kindly stay safe and stay healthy. Till we meet again.